and have it come out more often. So twice a week, we are bringing you, I think, terrific speakers. So today we are very excited. I've been trying almost since the beginning of this pandemic to get somebody from Health First to come on and be able to speak to us. We are going to have everybody muted. So just so that you know, we'll have you muted, but in the chat box, please feel free to type your questions, and we will get to the questions. We have a number of questions that we would like to ask the doctor to begin with anyway. And then Thursday, our next chamber chat is it's a different time than usual. So it's 3:30 to 4:30 with MorseCom. And they are, as you know, communication specialists, and they'll be talking about really what your business needs to have in order to reopen, make sure that you are ready for any disaster that could happen. With cybersecurity, we know that's unfortunately such a huge problem right now, and there's lots of scams that have been going on during this crisis. So I think that'll be a really, really interesting one. So join us on Thursday. And so now, though, I'd like to introduce Dr. Laird. He is, his family practice exists to give comprehensive, compassionate, cost-effective, and coordinated care to people of all ages. We seek to be your medical home. Our advanced state-of-the-art electronic medical record is designed to be the repository of your medical care. Dr. Laird grew up in Topeka, Kansas, as the oldest of 4 boys. His father served in the Kansas House of Representatives for many years, and his mother was and still is a registered nurse. So is my sister. Great profession. He has only had 4 jobs in his life. One was a farm worker at age 11 to 16, a school janitor from age 16 to 18. I'm not sure they would allow that now. School bus driver and church lay leader from 18 to 22, and a physician since the age of 25. Each of these work experiences has had an impact on his medical practice and life today. After graduating from his father's alma mater, he attended Georgetown University in Washington, D.C. on an Army scholarship, and then served 6 years in the U.S. Army, stationed in Honolulu, family practice residency in Hawaii, then in Kansas, and finally in Bavaria, Germany. Wow, so you have had some interesting life travels. That is awesome. His residency training was rigorous and included the full spectrum of family medicine, including obstetrics and gynecology, pediatrics, adult medicine, critical care, minor surgery, orthopedics, dermatology, and psychiatry. He has delivered hundreds of babies, but stopped the obstetrics part of his practice shortly before moving to Florida. He was certified by the American Board of Family Medicine in 1994 and has been recertified twice since then. In recognition of his training, service, and continuing medical education, he has been named a Fellow of the American Academy of Family Medicine. Dr. Laird served as president of the medical staff at Vieira Hospital for 2 years, previously having served 2 years as the vice president. He was selected chief of medicine at Health First Cape Canaveral Hospital twice and has served on numerous hospital committees. His interests are in tropical medicine and travel medicine. This includes being prepared for wilderness expeditions. He has experience in Micronesia as well as an underserved part of the Bahamas. He is trained in advanced disaster life support and is a fellow of the Academy of Wilderness Medicine. I did not know they had something like that. That's very interesting. A member of the medical staff at Vieira Hospital, he has professional interests in traditional family medicine, especially pediatrics, chronic disease management, healthcare process improvements and efficiency, office surgery, and ethics. In his free time, he spends time with his family, traveling, playing tennis, volunteering, and reading. Wow, that is quite an impressive bio there, Dr. Laird. The one thing though I have to ask before you get started, I did not realize that they actually have like tropical medicine and travel medicine, wilderness medicine. That seems very unique. Is there many that specialize in that?
No, that's a specific fellowship, and it's available to people who've done a residency, and it's really interesting. So we have speakers like Luann Freer, who runs Everest ER. She's in charge of the ER at base camp at Mount Everest. Various other docs who specialize in everything from taking care of Yellowstone, the Yellowstone medical director, to doing Haiti relief after earthquakes and things like that. So it's just interesting being able to practice in austere environments. So.
Wow. Yeah, that's very, very unique. And so are you able to talk a little bit about any experience you've had during some of the crises that have come up?
Yeah, so fortunately in Brevard County and in Florida, we don't have to deal with that most of the time, although we do have docs trained for that if that were ever to be if we got hit by a bad hurricane or had some of the tragedies that have occurred in other countries. But I learned a lot in an island called Yap in Micronesia, where just as an example, this is sad, but I had trained throughout medical school and residency, had never lost a child. And within the first 6 weeks in Micronesia, I saw 3 kids die, all of which would have been prevented had they been in America.
Wow.
And it's just, I'll never forget it. And it just really goes to show that's happening in this day and age in places that don't have, Western level medical care. And so anyway, it's a way to make you a better doctor if you go places where they don't have all the high-tech stuff we have in our hospitals.
Right, absolutely. Well, thank you, Doctor, for joining us today. I certainly appreciate it. I know that you have probably been very, very busy. So if you wanted to start off saying a few words, and I know then we'll field some questions. We already have some in the chat box and that, so I'll turn it over to you.
Sure. And before I say anything, one of my favorite people in the whole world is on the call. I see her there, Beverly Squire Wiggins. Just want to give a shout out. So hello, and so haven't seen you in a while. So
it's been a long time, Tim. How are you? How's the family?
Great to hear your beautiful voice.
Good to see you.
Yeah,
say hi to Rosemary.
I will. So here's the thing, and I don't want to do a commercial for Health First, but I, as a Brevard County resident, I was really proud of what we did and are doing for coronavirus. So, in pretty short order, when this hit, we stood up a command center and sequestered a bunch of really great people. It was literally a command center. I mean, it was a room where everybody was 6 feet apart, and there were TV monitors up, and we were monitoring world data, national data, Florida data, direct feeds from Florida Department of Health, and constant communication back and forth. There were calls. I think it was at noon every day, it was 10 o'clock every day from the Surgeon General. And we had people in supply chain who were on the phone with literally worldwide, with China and everywhere else, trying to get PPE for Brevard County, and they did an amazing job to the point that we never ran out. Now, granted, we weren't hit like New York, as we all know, but doctors trying to model. At that point, I'm talking about, in late March, we weren't sure whether we were going to have an Italy or a New York scenario or what. Thankfully, Brevard County, and I really have to hand it to the Brevard County residents. We're blessed to live in a place where we have, engineers, police officers, teachers, astronauts, rocket scientists, all living in our county. Very smart people. Everybody disappeared into their houses and didn't come out, pretty much, and flattened the curve. We never, our worst nightmares were not realized. We were trying to come up with plans to potentially put patients in gymnasiums, like they were in New York, preparing for all that. Never even got close to having to utilize that. And that's because the community flattened the curve. And, so I was very impressed by just the working together, the community, the health systems. And so we, fortunately, so far, did not get anywhere near exhausting our system's medical capacities. And so, anyway, that's my only comment. Is I was impressed by how Brevard County rallied to this so far, and of course, we all hope that that continues and that that we don't have terrible second surges and that sort of thing.
Yeah, the Florida Chamber of Commerce has put up every county. And so if you go onto their website, you can click on each county, and every day they update with the new statistics. So they showed today that Brevard County had 367 cases since the beginning. It was increasing. We've had I think it's 10 deaths that I had seen, and the daily average new cases was 4.1, and that was unchanged. The weekly percent of positive cases was 1.08%, which is also unchanged, which is very small. And I think you're right. I think people social distance very early. I think we were very proactive. Does it concern you at all now that, we've got the astronauts going back to space on May 27th, and the number of people that are probably looking to come into our county to see that? Is that a concern, do you think?
Yeah, I mean, mathematically, we as a country, as a state, as a local county, have a tough calculus to decide. We know the economic impact of the closure. It's also saved tens of thousands of lives in the country, these closures, but we all know the economic impact it's been. And so I feel for our political leaders, because they're really in a tight spot. I mean, it's kind of a lose-lose sort of thing. You can open up and save the economy, but you are going to cost lives. And so nobody really has a crystal ball to know what the right answer is. So yes, it is concerning having all those people here, and quite frankly, doing any opening is kind of potentially bad for the health system and the hospital census, but potentially good for the community's economy. And so, if we could open up and have everybody still, especially high-risk folks, elderly, people with pre-existing conditions, if they just plug their ears, don't consider us opened up, stay put, stay in your safe homes, and everybody's washing their hands and all that, maybe we'll have our cake and eat it too. We'll be able to save the economy and have more semblance of normal education and business opportunities, and not have too much of a surge. But as Dr. Fauci and everybody else says, our numbers are going to go up. I mean, if we open up, they are going, it's not a question. I mean, they are going to go up. How smart can we be with continuing the distancing and the hygiene and all that? That remains to be seen.
Well, we've seen Health First has been wonderful, sending out information almost every day with protocols that you're putting in place, and how you are handling both the patients that come in and then your staff. Can you tell us a little bit about how Health First has handled the situation?
Yeah, so we have tried to do our part for social distancing and keeping our patients safe, obviously. And so we're trying to do a full court press from, checking the temperatures of all of our staff to impeccable hand washing, impeccable cleaning of the rooms, even more than we usually do. Everybody in our systems are wearing a mask. We are, obviously, sick people are staying home. We are keeping our waiting rooms as empty as possible. When people come in, we're putting them straight into a room as best we can, and keeping sick people away. And knock on wood, I mean, we have very few COVID patients in any of our offices and that sort of thing. So I joke to our patients that our offices are probably safer than Publix. Nothing against Publix. I mean, Publix is wonderful, but we're pretty darn safe in our hand sanitizer stations, et cetera. Our patients in the hospital, if they have coronavirus, are sequestered into a safe respiratory isolation unit where they have negative pressure so air doesn't mix with other parts of the hospital.
Oh, wow.
It's amazing what they set up. We had engineers with cranes. If you saw any of our hospitals in April, there was huge cranes outside of them where they were attaching big air handlers, making sure that we had safe respiratory isolation units. So yeah, it's, health system wise, we're safe. I have no concerns at all. It just remains to be seen what happens to the numbers over the next few months.
Well, and do you find, I mean, I think they were looking at some of the statistics in that people weren't going to the hospital because of the concern that they would get sick going to the hospital. Is, you've kind of really reassured us knowing that you have that filtration system that was put in place. Was there other things that your hospital did that we can, kind of get the message out to reassure people, because that's a concern too, that they're not going to the hospital when they need to, seek care?
Yeah, that's what we think is we have a lot of docs who are concerned that people are letting cancers go, people are letting their diabetes go, people are, delaying preventive care, and we don't want to have a situation in the next 6 months or year where preventable diseases have, people are having heart attacks and strokes and cancers that they could have been avoided had they gone to the doctor. So at this point, obviously we're all still concerned about coronavirus, but at this point, that should not be our primary focus. I mean, we ought to be focusing on our health, getting any testing, medical conditions that you have addressed and fixed and optimized, because let's face it, I mean, if there is a second surge, you don't want to be out there with, you ran out of your medicines 2 months ago and now you're a victim of coronavirus. So I would say we're all paying attention to coronavirus, but let's not forget the basics. And so that's, I guess, kind of health first message is let's make sure that you are up to date on everything. We're open for business. The doctor's offices are. Don't let fear make you sicker.
That was one of my concerns almost right when it started, because I did need a prescription renewal and they didn't want to, and I didn't want to go into the doctor's office because it was kind of right at the beginning, and it was like, well, I don't want to go for blood work because then you're in a room of sick people and this is just renewing my prescription. So the doctor was very nice and did renew it, and I think a lot of this telemedicine has kind of exploded during this. What do you see that as a trend or things that you've been able to do?
So that is here to stay. I mean, that, telemedicine was already here, but none of us really, I'm sorry to say, didn't really take it all that seriously, and we weren't really on it full bore. And boy, coronavirus nationwide has kicked that in high gear, and patients love it, and I love it. They're fun. And us doctors were talking that we actually get to see inside the patient's houses a little bit and kind of, see that, oh, I didn't know he, lived on the beach or wherever, has 3 cats or whatever. So we love it. The patients love it. It's pretty high quality. And some of us old-fashioned guys thought, well, but we can't listen to their heart. We can't poke them in the belly. We can't do our physical exam that we like to do. But it's interesting how much you can do without actually touching. So, your high blood pressure medicine refills and evaluations, a lot of your diabetes care, a lot of the psychiatric stuff. I mean, whether it's depression or ADD or a lot of these things, just talking to the patient and is the most important part. Probably, poking them and listening to their heart and stuff isn't that important. Obviously, we can't biopsy a skin lesion or inject a shoulder or things like that. Those still require visits, but I don't know, I'd say probably 40% of the doctor's visits that we do in primary care could probably be done more efficiently and easier for the patient. And, we've got patients who are truck drivers. It's hard for them to get into the office, and, teachers are busy until school's out usually. And there's just so many people who driving to the doctor and waiting in the waiting room and then going to see them and going home and going to the pharmacy, is just not how things are going to be done in the future. We're going to be doing a lot of these televisits, and some of the pharmacies even deliver to the house. So you could envision a time in the future where your kids aren't going to go to the doctor. They're going to stay in bed sick, be seen by the doctor virtually, have the prescription delivered an hour later. And I mean, that's pretty cool.
Yeah, that's wonderful. Well, and isn't that, I think some of the concern too, like 'cause sometimes with doctors, they are so overwhelmed with people in their offices and waiting and that, where I was wondering if with this telemedicine, you can schedule things a little bit easier and spend a little bit more time because there isn't all that other pressure that you might be under.
Yeah, that's true. Yeah, that's true. And you can also do things at different hours. So, if our office is open for whatever, just say 8 to 5. Well, if somebody's sick at 5:30 or 6, your staff has all gone home, you can still do a computer visit, and stuff. So again, it's not going to do away with the in-person visit. There's a lot we can do from an in-person visit, but for that percentage of visits where you just need something refilled, or you just need to ask a question, or you just want to go over lab results, or you just want to talk about something. I had a patient today who just wanted to talk about a second opinion sort of thing. And he, didn't really have to come into the office. And boy, how convenient to just sit in your pajamas in your front room and talk to the doctor. It was really neat. I enjoyed it.
That's great. Well, so then do you find that because of the quarantine, diseases that might have normally, arisen at this time of the year, whether it's high allergies or other things, have been on the decline because people have been social distancing, or not so much?
Yeah, well, I don't know. I can't wait to see the final statistics, for example, on the last of the influenza season. We usually lose 30 to 80,000 Americans a year from influenza, plain old influenza, not corona. And the fact that America mostly sequestered themselves in March and April, I do wonder whether the final tally, when it's written up on how many flu deaths we had, will be less. And I don't know if you've seen the data on car crashes, but all the auto insurers are given refunds because they're just not seeing people in crashes as much. So interestingly, I mean, a lot of us are safer in our homes than out there in the world. And so there probably will be some side benefits of this staying home.
Right, that's very true. It was funny because I had not filled up my car. I still haven't actually filled up my car with gas since mid-March. And so I'm thinking, I got out driving, and it's almost not like you have to learn all over again, but really be much more aware, because by staying at home and not doing that, I thought, okay, well, everybody's out again and the accidents will start increasing again. But we already had our first named tropical storm that went through. We're getting towards hurricane season. Do you think that when there's shelters and the hospital has to make plans, and now, with this COVID-19, how are things going to be different when we plan for this season, when you have to keep social distancing until there's a vaccine?
Yeah, no, I missed part of that. The social distancing, how's it going to affect what?
When we have the shelters during hurricane season, if people have to, evacuate and go into a shelter, I know the hospitals, I'm sure, have some plans, but what do you foresee, how we kind of deal with that when, they're all coming off the island, and I mean, it can be a huge portion of our population looking to.
So my guess is, and of course I'm not in the position to make these decisions, but my guess is they're going to have to maintain distance. So that may mean more shelters, with people spaced out more, because you're right that let's just pray that we don't have a active season this year. But my guess is that would be a disaster if they had everybody on top of each other.
Right. Somebody asked if the pandemic has affected Health First economically, because I know a lot of the elective surgeries were put on hold for quite a while and that. So how have you guys fared through all of this?
Yeah, well, like all systems in the country, the shutting down your hospitals to be ready for coronavirus patients did affect all the regular surgeries that normally, keep hospitals and health systems healthy. So, fortunately, we, as a larger system, we kind of have saved to be ready for that. But absolutely, it has affected us just like. I guess in some parts of the country, there's, hospitals going out of business and stuff like that, but because of several months of not being able to do what you normally do. So, but we have reserves, and we're totally open full bore, and we're moving on.
Okay. Somebody asked, they would like to determine how to best contact HHS for contract tracing if it's needed.
Well, contact tracing, you wouldn't, I don't know, you wouldn't contact them. I think with contact tracing, that's more for our public health department. So, okay. They've got epidemiologists that are supposed to find the cases and then find who those people were around, so that so that you can tell those people that they've been infected. And that's, by the way, a lot of people may not know, that's something they do year round. So usually it's not for coronavirus, it's usually for other contagious diseases and sexually transmitted diseases and things like that. They contact trace all the time. So this is kind of something they're good at. As far as a regular lay person trying to do it, there's confidentiality rules and stuff like that probably you wouldn't get very far.
Okay. From Joe, he said, I've seen the entire healthcare community come together as a whole during the COVID crisis. Have you seen the same thing, the unity?
Oh yeah, very much so. I mean, we everybody, it's kind of like, I hate to say it, but it's kind of like during a hurricane. Mm-hmm. So during a hurricane, I mean, there's never as much working together in unity. We're all in it in the same boat, and as Americans and as Brevardians, everybody's kind of proud to go to work, and we're no different than I'm so proud of the restaurant workers and the police officers and just everybody does their part to keep us safe and our community working, and so, but yeah, healthcare system as well.
And so, emotionally, this has been a toll on everyone. And, I know that the mental health industry, especially here in Brevard County, sometimes it is difficult to get services. But what have you found has been kind of like the toll on our society, and options or solutions that are available for people?
Well, I would encourage people not to ignore their mental health. This is a very nerve-wracking time for so many reasons: economic, health, deaths, that sort of thing. So I think it's very important for people not to ignore their mental health, to see their providers. You're right, mental health care providers are in short supply in a lot of parts of the country, and are at Brevard as well. So that's another reason. Get in to see your doc, or that's a perfect virtual visit. Get to see your doc for a virtual visit. There are psychologists and psychiatrists who just do virtual visits. I have a friend who she is out of Orlando, and that's all she does is virtual visits, and has for years. So get in and get seen and get treated, because it's no different than high blood pressure, diabetes, or anything else. You've got to get it controlled. I mean, we've got ways to control most of these conditions, and it's not perfect, but it's a heck of a lot better than letting them fester.
And so now with technology and these virtual visits, do you think that, or do you know of equipment that will be able to provide some of the sensory data to doctors so they can evaluate patients easier remotely?
Yes. So, okay, we are in 2020. We are in the beginning of it. So history books will be written about how we did it in 2020. So we're a little bit in the dark ages. So the best thing you can do now is get a blood pressure cuff,
Okay.
And sometime, as soon as the shortage goes over with, get one of those oxygen sensors. I mean, they sell them for like 20 or 30 bucks at Walmart or Walgreens or Amazon or whatever. So get a pulse oximeter, it's called. And so that right there gives you your pulse, which is your heart rate, your oxygen level, and you get your blood pressure. And for extra credit, get a thermometer. And so if you do all that, that's good. Now, that will be considered barbaric in 10 years when every family will have an otoscope that looks in your ear. It'll look at your little skin mole, look in your throat for strep throat. You'll have all this on a stick. You'll have basically a doctor on a stick in your house, and it'll be really easy, but that isn't available. Oh, also, stethoscope. They have a stethoscope that feeds like Bluetooth into your computer, and you'll be able to take in breaths and listen to your heart, and they actually do exist in some places, but I haven't really seen it be affordable. But everybody's going to have that in no time, and your doctor will literally be able to do a pretty decent exam on you right there in your bed.
So what do you think about the reliability of everybody? You know, they're wearing their FitBits and they have all those, you know, kind of give your heart and blood pressure, that kind of thing. What do you think about those? Or do you think having the traditional, put the cuff on and actually check your blood pressure is a little bit more accurate?
Well, I mean, the Fitbits don't really do your blood pressure, but they do your heart rate. But those things are pretty darn good. Okay. I mean, we've had some guy, I never forget the guy that I had recently who had an arrhythmia, but every time he got to the doctor's office or the hospital, it was gone. So we gave him, I think he had an Apple Watch or one of those things, and he was out offshore, deep offshore fishing off of Port Canaveral when it happened again, and he was able to hit some sort of recorder, and he went to the hospital and was able to show that he was really in a dangerous arrhythmia, and it was all caught by one of those things. And we would have never caught it because he couldn't have gotten into the hospital soon enough. And so we needed to see what type of arrhythmia he had, and he demonstrated. So those things are pretty good. I mean, yes, there's more sophisticated ones in the hospital, but those, again, we're in the early stages of technology on those, but they're pretty darn good.
Okay. Another question, do you have any specific training for hospital staff on how they protect their families?
There's a lot written about, just like everybody I think probably has Facebook groups that they're part of and stuff. Believe it or not, there's one for doctors for coronavirus that's worldwide. And so all during this whole thing, we were getting our colleagues in Italy and Germany and even China and other places were sending information about what they were seeing. And I mean, the explosion of information was just crazy. And, you know, as you saw in the national news, as far as, you know, hydroxychloroquine or not, and ventilators or not, and all that stuff kept going back and forth. And one of the things is how to keep your family healthy. Now, I mean, protecting our families from infectious disease isn't new really to us. And so we have all, myself included, been sequestered in certain parts of the house at in early stages of this. And so, yeah, that was, you know, you saw doctors living in tents and RVs and tree houses and all that stuff just to keep their families safe. And yeah, that's part of the job.
Yeah, my sister, like I said, is a nurse as well. And so she, you know, would grocery shop for my parents and leave it on the front porch and couldn't see them for so long. And yeah, definitely trying to make sure, especially being a visiting nurse. So you just never know what you're walking into there. Another question from Andrea, has Health First partnered with Advent Health?
Yeah, well, we have a pretty good relationship with Advent Health. And so I think they've gone back and forth and shared best practices and ideas and that sort of thing. But I know we're in communication with them about, you know, various treatments and things like that. But that's probably the extent of that.
Okay. And then we were talking about stress and anxiety. Caroline asked, have you seen an increase of cases of anxiety or depression in the community because of the quarantine or social distancing?
think, me as a provider, I would say maybe a tiny bit. I mean, at least in my practice, people are pretty open with me anyway, and it's always on people's minds. I mean, a little bit more now than usual, but I think probably overall, just everybody's a little more on edge right now, just because of the scariness of the news. But I don't think it's I think it's worse, quite frankly, during hurricanes when it's more compressed. It's all happening in 4 days. You see more of it. And this is kind of a long, drawn-out thing, and people understand it. And I think they're seeking care when they need it.
Yeah, I would also say too, with our county, we are not like New York where people have been in their apartments and not able to go anywhere, with the beaches open and parks open where you're able to go outside. And I think it makes a huge difference, because when you're able to still get outside and get with nature and kind of, unwind, then it definitely makes a difference. My families in Canada, and their parks have been closed. They weren't allowing anybody out, and I think that's much more difficult to be in that kind of environment for 2 months.
Yeah, that was yeah.
Another question was, what insurance benefits will result from having this technology? I was kind of wondering, because with office visits, that's how hospitals and doctors get paid. Have they kept up with this new technology to be able for reimbursement and I think saving money actually doing this?
Yeah, I know Health First health plans, they have, I think they've even waived people's co-pays for those kind of visits. And so they've been all over it. Other insurers, I think for now, have been covering virtual visits. The question is, when coronavirus goes away or dies down, are they going to continue this? I sure hope so. Seema Verma, the head of CMS, said the other day that telemedicine is here to stay. And so I think I took from that they're going to recommend nationally that telemedicine just be part of benefits that insurers provide. But I sure hope so, because, like I say, patients love it, and I know the Health First health plans is very in favor of virtual care.
One of the other questions, has Health First had a lot of the hospitalizations of the COVID-19 patients? Have you had to deal with a lot of them?
Yeah, we had a fair number. I don't know exact numbers, but it was much less than we feared.
Okay, good.
The vast majority of those patients did well, and so we had. Do we know for sure how many we had? I don't know how many we had, but we were. Thankfully, and somebody knock on some wood, it was never close to overwhelming our system.
That's great. Well, so then what suggestions or guidelines would you recommend for businesses that are now starting to reopen? I know that the CDC has some guidelines. We put one out, the Chamber has Work Hard, Work Smart, Work Safe, and it was a playbook for reopening your business and had all the different kind of types. So if you were a hair salon, if you were a dog grooming, what protocols to follow. But do you have some recommendations that people can follow when they're looking to reopen their business?
Yeah, so not to be paranoid, but you're contagious with coronavirus before you're sick. So that's the hard part. If it was just everybody who had, 103 fever and coughing, it's easy to avoid those people. But, the best thing, again, not to be paranoid, but just assume every healthy person you see is in the first 2 days of their coronavirus exposure. So they're contagious. They don't know it. You don't know it. So just wash the hands, stay away, if possible, wear the mask, if the more the better. And that's going to protect people. And again, if you don't have to be out, just stay sheltered in place. because like you, when it's 78 degrees and beautiful outside, it's not that hard. You can go outside for a walk and, do other things outside. So, but that's the mentality, is just assume everybody's got it and you'll stay healthier.
Yes, there's something to be said for that, where, people don't, they think, oh, well, they seem fine, but you're right, you can't assume that. And the incubation period then, so how long is that normally before people start showing symptoms?
So it can be up to 14 days.
Okay.
Usually it's on day 5.
Oh.
So you can be sick for several days and you won't be sick, but you're contagious for several days, and then you get symptoms. And it's you just have to kind of assume the worst, and there's nothing wrong with keeping yourself in a little distance and keeping your hands washed. The other thing to remember is most people give coronavirus to themselves through their hands, touching their face and all that. So it's not so much that somebody breathed on you, it's that you, didn't wash your hands and touched your face, and that's that. So just keep that in mind too.
Well, so then what do you recommend with gloves? Because my thought was always, well, if you're still doing the same thing with the gloves on, where you're touching your face and doing all that, it's not really making a difference. It really has to be washing them or using the hand sanitizers.
Yeah, don't wear gloves. I mean, that's for surgeons. Wash your hands. Soap and water.
Okay.
The gloves, you're going to be fiddling with them and touching them. You're not going to wash soap and water. Just throw away the gloves, soap and water.
Okay. Yeah. I was helping outside and the sweat was just running down my hands and everything. It was very uncomfortable. And I thought, I'm touching myself more with this and them than, so somebody though asked about the mask, because do you find, is there a difference between like the kind of blue ones that you see that are more of the regular type ones, as opposed to some of the cloth ones that people are wearing? Do you think that there's any difference or preference?
Well, remember, the main thing to remember about masks is the mask doesn't help you. It helps the people from your sneezes.
Okay.
So that's the thing and that's why surgeons wear masks in surgery, is anything coming out of their face is not going to get on the patient. But the masks, unless it's one of those N95s that's super tight, it's not going to protect you. It protects everybody else. So when you put on a mask, you're being nice for everybody else, but you're not protecting yourself.
Okay.
And
then,
yeah.
Sorry, go on. Sorry.
Well, so anyway, so just, nothing against masks, but just remember it's not protecting you.
Okay. Well, then they were wondering then, when are they no longer contagious? So if, usually after 5 days, that's when the symptoms start showing. At what point in time are they no longer contagious?
Well, and again, this is the data on this is changing. What we at Health First and most places in the country are saying is, if you've been exposed to somebody, you're not out of the woods for 14 days. But on day 15, you don't have it.
Okay.
So yeah. So the real answer is 14 days.
14 days. Okay. So then if somebody is contagious who lives with an infected person, but they don't seem to have the virus, is somebody contagious who lives with an infected one, but they don't seem like they have the virus? Could they be contagious if they're living with somebody that has it?
Yes. And I'll answer that question in 14 days.
Okay.
so they're potentially contagious, but I can tell you they weren't after 2 weeks.
Okay. The other question is, if you assume everyone has COVID-19 and are a business owner looking to open, what would you recommend, suggest from an air purification standpoint? Having a UV, an ion, or hydroxyl?
Yeah, boy, we don't know. I mean, we're just not sure if those are worth it or not. And now, even though I said assume everybody has it, I will say that it appears that the incidence of it in Brevard County is like very, very low. Like,
yes,
I don't know, 1%, 2%, something like that. So don't tell anybody, but everybody probably doesn't have it. But I just want you to think that everybody has it.
Yes.
So that when you're around that 1 or 2 people out of 100, that you don't get it. But I don't know, the air purifiers, they're still working on those. I can't answer that.
Okay. They were wondering how effective ultraviolet lights are for disinfectant.
Pretty good. So like, for example, there's been some studies where like surgical masks and stuff in hospital systems are sterilized with ultraviolet light, and like they're sterilized within, like, I don't know, a couple minutes.
Oh, wow.
So it's pretty good, but whether you can, how practical that is in a business, whether you could run around with an ultraviolet light, sterilize everything, probably not as good as, just some cleaner.
Okay. And then do you have any recommendations on schools reopening? I know. Big
I'll
question.
leave that to Governor DeSantis.
Okay. I know. I think that's going to be a challenge because when they look at the numbers, children are, not really infected as much, but they're worrying about them carrying and infecting others, right? Is that what the big concern is with children?
Yeah, that's just, and they're not going to socially distance if you've ever seen a bunch of 7-year-olds. Yeah, that's a toughie. I mean, hindsight's going to be 20/20 on that one.
Yeah. And are you optimistic with some of the treatments that they're trying to develop and they're studying? It seems like they're really fast tracking a lot of, they're trying to get some, what do you call them?
Yeah, there's treatments and vaccines and all that. So if they could get a treatment out there, that would be wonderful because we could use that immediately. And I'm really hoping that we get some sort of treatment. Now, the negative side of that is, out of all the viruses on Earth, our track record in getting viral treatments is pretty poor. Antibiotics work on bacteria, but we don't have much that kills viruses. So the best we usually do for viruses is vaccines and prevention. And there's a reason for that, and I don't know how much time you have, but bacteria actually try and infect you, and we can kill the bacteria because they're alive. Viruses go into your cells and hijack the machinery of your own cells. And so to kill a virus, it's hard to kill something that's dead, that isn't alive itself. Because it goes into your cells and makes your body sick from the inside. So that's why treatments are, I hope we get something, and there's a lot of smart people working on that, but I'm not, really thinking that's going to necessarily be happening real quick. But vaccines work extremely well, and we've got a lot of smart people in the nation and in the world working on those. One of my I've got a friend who's the lead vaccine researcher at Duke, and I mean, this guy's just wicked smart, and I mean, he's all over it. And they've actually got virus particles from Wuhan that they are making vaccines against it. And thanks to a lot of work that's been done over the last few years with the Gates Foundation and others, they've learned how to make vaccines quicker than usual. Of course, expect the usual conspiracy theories to pop up and tell you why you shouldn't get it. But that's our real hope is getting some immunity.
Well, and do you think, because a lot of people don't always get the flu vaccine because they say, well, it doesn't necessarily mean it's going to work on this year's strain of the flu virus that comes along. So what do you think about this one with COVID? Because isn't it mutating a little bit or not?
They've already thought of that, and
Okay.
They are making the vaccine against the part of the virus that doesn't mutate. They have looked at where on the virus the mutations are occurring, and there's a scientist in New Mexico who's really on top of that, and they're thinking that through. Not to say that it won't mutate like the flu virus does, but what I tell my patients when they give me that one, because they try that one on me, and I say some immunity is better than none, which is what you got right now because you haven't had the flu shot. And so, yeah, every year that comes out that the flu shot only worked against 26% of the strains or 40% of the strains. So what? If you don't get the flu shot, you're at 0.
Got ya. Okay, and I think probably one last one, which Sweden was kind of, you know, the one country that did the herd mentality. They were very smart in making sure people that were more vulnerable did stay in place and that, but they, you know, have been kind of the experiment with this. What are your thoughts on that? Do you think that that herd immunity is kind of legitimate or an option?
Well, so here's the thing. So if Brevard, I think Brevard County has 600,000
Yes.
people, I think. Okay.
Yeah.
So if for herd immunity, you want most of the people to get it.
Okay.
Okay, the disease or the vaccine. And so if we had let just in Brevard County, say 80% of the people get the virus, and if I think, what is it? It kills like a couple of percent, maybe 2 to 3%. We would have had 14, I did the math the other day, I think 14,400 deaths.
Wow.
In Brevard County. 14,000 deaths. We've had 10.
Right.
So, you know, I don't know how Sweden has done it. I mean, there's probably, I don't know if their population is similar to ours and that sort of thing. It will be interesting. I'm sure, again, books will be written on this, and
right.
maybe they've done it a smart way, but we could have been looking at, you know, thousands and tens of thousands of deaths.
Right. Yes. And I think that was what the predictions were. I think that's why, you know, people did start social distancing so quickly, because there was that concern of how rapidly this could spread and overwhelm the healthcare system. Well, I want to say this has been so informative. I am so thrilled that you were able to come on and answer some of our questions. I think Health First has done a phenomenal job. We get so many great emails from them. We've been sending them out. I think one of our highest opened rater, ones that had the most comments, and we post on Facebook all the time, was from Health First, when you were talking about how you are taking care of your both your employees and your patients. And I think that the community really appreciates all that Health First does. I know you guys are top notch and you're always on cutting edge and bringing in, you know, technology and really, I think for us in Brevard County, we are fortunate to have Health First as our providers here. So thank you so much, Dr. Laird. We really appreciate you being on with us today.
You're welcome. Brevard County is a great place to live, and we consider it an honor to care for everybody here.
Well, this has been live streamed as well, so everybody can re-watch on Facebook, and we certainly appreciate your time, and we hope you are safe and your family is safe, and thank you for doing what you do, because being on the front line, it really, I mean, you just never know. So we thank you for your, you know, helping everybody during this time. So thank you, Dr. Laird.
You're welcome. Thank you. Bye-bye.
Before we finish, we want to say happy birthday to our president, Nancy.
Oh, geez.
Happy birthday, Nancy.
A little singing to Nancy. Happy birthday, Nan.
Oh, thank you, Carolina. No singing.
Happy birthday, Nancy.
Well, thank you, Joe. Yeah, appreciate everybody being on there and all the very nice birthday wishes that I've had so far. I almost had to go to the hospital when I fell off my bike twice, but that was okay. I am a pain reliever right now. It's working out just fine, but yeah, thank you all. I hope you join us then. Our next one is, like I said, it's a later time. So it's Thursday, 3:30 to 4:30, Morse communication, Morse comm, really talking about cybersecurity. And I think it's going to be very important for businesses, you know, reopening and making sure that you've got your systems protected and safe. They are definitely the experts in this area. So once again, a huge thank you to Health First. We've been trying to have a representative on on for quite a long time, so I appreciate Dr. Laird taking the time today. And if you guys have any other questions, I'm not sure they'll be able to answer them, but we can always forward them along, and you know, they can maybe type in a few answers. But thank you all, and we'll see you next time on the Greater Palm Bay Chamber of Commerce Chamber Chat. Bye, everyone.